Welcome to FOBtv, the future of business. I'm your host, Kevin Benedict. I'm a futurist and partner here at TCS, and I'm very excited to introduce our guest today. My guest is Smriti Kirubanandan. She's a healthcare strategist, public health expert. She's also earned her Bachelor's of Science in Computer Science and Engineering, focused on robotics. She also has a Master's in Engineering Management from USC, a Master's in Public Health from UCLA. Plus, she is a certified raw vegan chef and nutritionist. Smriti, that's incredible. I feel like such an underachiever.
Thank you, Kevin, for having me. It's such a pleasure. I'm grateful for this opportunity, and try to keep the underachieving still, under the radar for some time now.
So you are a public health expert who's passionate about driving equity and equality around food nutrition and improving public health by eradicating hunger, improving food policies, and executing strategies for sustainable and equitable healthcare access. What a mouthful. What a mission. Thanks for joining us today.
Thank you for having me. I'm grateful again. Thank you.
So what inspired you to start your journey in food equity and public health? But before we have you answer that, food equity, what's that mean to you?
So food equity to me is basically how each human being is treated equal and they all have access at an equitable format to healthy food. So, their backgrounds, their economic backgrounds, their education, where they live, shouldn't be a factor for them to have access to nutritious food. So that's by definition what food equity means to me.
Oh, that's interesting. And we'll dive more into that shortly here. So what inspired you to get involved in that space?
Having spent a significant amount of my time in both the Eastern and Western worlds, I think I've seen firsthand the socioeconomic differences and how it's important for us to create an ecosystem where everyone's leading a life with dignity, but is also having access to basics such as food, shelter, healthcare, and the other foundational blocks, but also hailing from a family of doctors and politicians. I think I was naturally inclined to healthcare, serving others, and having a personal passion for nutrition and being fit. I think my passion space was automatically just food equity, public health, and how can I work on this foundation block to make our lives better and make a community much better.
Got it. So thank you for giving us a view into your background and kind of what helped you focus on this. So over the last couple of years, we've all been preoccupied with the pandemic, but there's still a lot of health challenges and public health challenges, and some of them have even become more pronounced. Talk to us about that.
Yeah, it's a little unfortunate, and I'm glad, we as a society are doing better with research, innovation, and obviously a lot of empathy. But, I think you're right. I think we have to use a different lens, I think. And I think what the pandemic has actually done is it zoomed into what is already existent and made us more aware. And these issues which are facing now, such as lack of healthcare equity, increase in healthcare costs, fragmented data sets, and a lot viewing patients in a 360-degree format, they were already existent. And I think the pandemic, while we're trying to get people vaccinated and trying to make our weakest links stronger, I think we had to focus on these foundational problems. And I think that's what's really happening. I think it's unfortunate that we have to address this in a survival mode, but I think it's good that now we're pivoting and moving from a traditional view to more holistic, innovative format, eager to move to a thriving format collectively. And some of the issues that we're seeing is obviously lack of access to nutritious food for vulnerable population, for senior living people, lack of access to one's medical records, increase in healthcare costs, increase in homelessness. Many members, as you would see, Kevin, is that they don't purchase even their prescribed medicines because of the immigration status or because they don't have enough money to be able to complete that, that process. A lot of people don't go to healthcare because of lack of immigration, lack of money, lack of lifestyle support, the list goes on and on. But as we dive deeper into this and coming from TCS, from a technology perspective, I think what we also need to start focusing on is how do we move from digital divide to a digital bridge? Because as we're focusing on, telehealth and all these issues, we'll start seeing that a lot of zip codes, people don't have even access to a faster broadband, right? So without that, how can we have access to proper healthcare and physicians and care? So I think we have to start opening up the ecosystem and also addressing the foundation and trying to fix the foundational issues with clarity, empathy, and definitely start partnering with other organizations to make this much more efficient and innovative.
One of the things that the past 2 years has also taught us, Smriti, is that it's not just about having the right vaccines or medicine or facilities or access. Information is so critical and misinformation and the disinformation that's out there can create havoc with the public health campaigns and programs that are out there. How does one even, address that from your perspective?
That's a great question. And I think it's a very complicated one because I think perception creates reality. And, that's the same thing with information. You believe in something, that's a reality. And it's very difficult to, have that kind of a conversation with people. But I think the right way to approach it, or my recommendation, is to do your own research with less bias and also think about how your individual health impacts the public. So your choices have a ripple effect. I think that's the most important factor I recommend everyone to think about, is their choices has an impact on their families and the community and the public health. And we need to start being less concerned about ourselves and more concerned about the society and community. I think that's the only way we can kind of move from misinformation to kind of narrowing down to what's right and what's the right thing to do.
So you write about social determinants of health, SDOH. I even had to ask you about that. What's that stand for? But yeah, social determinants of health. So what should we understand about these?
SDOH, as you know, through COVID, it's become such a big buzzword, just as many of the buzzwords we have right now, which is, diversity, inclusion. So I think SDOH is the term that's being used extensively right now to determine all the living conditions of a person and how that determines their current health and the access to healthcare. So what we need to realize is a person it's not just about the food, the healthcare, and the access, right? It's more than that. The combination of the economic status, the lifestyle stressors, the mental, physical health, the immigration status, the cultural status. So we have to start looking at a person at an intersectional point of view than just a singular point of view. And from a healthcare perspective, we have to open up this ecosystem and acknowledge that this is a very complex situation, and how do we need to approach this in a more curious format and ask the right questions, understand their background, and then customize and personalize the solutions we give to them based on the demographic and the status they come from. But also from a technology perspective, I think what's really key is collecting data, predictive analysis, and also having actionable insights are key ways we can further help our healthcare colleagues to address these issues. And I hope that answered your question on what I think SDOH really is.
So getting back to the subject of food equity, where can we see inequity demonstrated around food? And what are the consequences to public health?
So, the term of food equity, as we do public health research, or we're trying to create policies, what we start looking at is where does a person belong in a zip code? And we are very much focused on the zip code because the zip code is one of the key factors that reflects on one's economic status, their education, their race, where they are currently in their life. So if we look at the zip code, there's lack of access to healthy food, there's an increase in healthcare costs, a decrease in accessibility to healthcare, there's a decrease in education, awareness. So when they don't have access to such a foundational block, then how would they have access to healthy food? How do they work in their full potential? How do they have access to healthcare and manage their families and the stresses, right? So, and all of these, if you look at the whole healthcare issues we have apart from COVID, the other issues which we face in the United States is obesity, diabetes, cardio issues, stress, anxiety, depression, and all these are not all related to food, but I think food plays a very important role in everyone's life. And by addressing this block, we can make sure we prevent people from going to hospitals and having severe conditions. And we can see this inequity is demonstrated in cost of our foods. As you know, supply chain is very expensive right now, and higher the cost of healthy food, there's a decrease in our health on our daily lives, right? So, and also there's an impact we have to see clearly during the pandemic. People with also pre-existing conditions, and that's being linked to the lack of access to food, lack of physical activity, they have been proven to show that they have much more complicated issues during the pandemic. And we also know that food is thy medicine, and it does play a vital role in our health on a day-to-day basis. I think we need to start addressing this foundational block to make a bigger longitudinal impact for the healthcare value chain.
When I was researching before this interview today, I saw in an article that you wrote, we have to look at patients in a holistic manner and solve issues from the ground up. Talk to us about that concept.
So, it's interesting that you and I are talking about the term patients, right? And, physicians talk about it, public health experts talk about it, but we're all patients here, right? They're not a specific group of people, and we can't forget that. I'm a patient, you're a patient, our family members are patients, we all have issues, we all go to the hospital. So I think that's one, consciousness that we'd like to bring to the conversation, but also solving the issues at a surface level, which is what we do, is, automating blindly or trying to fix the symptoms of a problem, is that we're just trying to add layers to the issue than addressing it from the ground up. And when I say ground up, I mean, let's not be afraid to look at the cracks in the foundation and address it in a holistic format. So that includes issues such as racism, food inequity, so that we can build a stronger home on top of this foundation and then start automating things and addressing things at a more technology and innovative levels. And many healthcare leaders are now working on this and coming up with innovative concepts, such as Uber partnered with Papa to make sure senior living and vulnerable communities have access to food and healthcare at a more affordable rate and accessible rate, and we can meet patients where they are. So that's one of the examples, but I think in a holistic manner is also not forgetting that a patient has much more complex layers when they enter that clinic room than just the issues they bring to the table that particular day.
So what is your recommendation for the kind of approach, the kind of policies, the kinds of things that we can do to address this? Because this is huge, right? And it's not just in one location. These kind of challenges are global even. But at a local level, are there things that you would recommend? Is there a place we should start?
I think change starts from home, and that goes through our streets, that goes to our community, and then that goes to a state level, right? So I think where we need to start is with ourselves. One, be empathetic, and second is understand and read a lot of information and open up our minds to what impact do we have as an individual, and let's not take ourselves for granted is one key factor. And where we need to start is with our own communities. Look at your own zip code, see where there's improvements required, whether it's a sidewalk needs a repair, whether there's more nutritious food is required. Write to your city council, write to your state council, and it's time for, speak up is what I would say. And, the other thoughts I have, recommendations for improving public health is information is key for analysis and innovation, and engaging with different stakeholders and communities makes us understand that we are currently living in a bubble, and we need to expand our bubbles and start intersecting so that we can become stronger and faster and better.
Smriti, thank you so much for joining us today and sharing your expertise.
Thank you, Kevin, so much for having me. I hope this session was a little more enlightening for people who wanted to understand food equity in public health, and also hoping it gave them an opportunity to understand the individual impact on public health.